Incontinence in men, it happens, but we don't talk about it often. And unfortunately, because we don't talk about it, men don't realize that there's help and there are things that they can do. Incontinence for men is extremely common after having the prostate removed, either due to hypertrophy of the prostate, meaning the prostate has just gotten bigger and it's become a problem at that point. And that occurs naturally as men get older. So the prostate can become enlarged as men age, and it can be a normal part of aging. However, if it becomes too big, then it can be really hard to release urine, and that can cause them to retain urine within the bladder. Another reason why men may have the prostate removed, which can lead to incontinence, is because of cancer. So either the prostate is too big, causing issues, or cancer is present, indicating we need to remove the prostate. For both of these situations, incontinence is generally the outcome of surgery, but it does not have to be a long-standing symptom. So even though we expect for men to experience incontinence immediately following surgery, they should hopefully not be experiencing incontinence for an extended period of time. And I'm talking about, I've had people come to me and say, hey, I've been dealing with this incontinence now for several years. And that makes me a little concerned because they have not received any treatment when it comes to pelvic floor care. So these men have simply been wearing pads, which are needed and helpful. So that way, of course, they're not leaking through their clothing. But there are other solutions that are available. The first solution is teaching them how to properly do a kegel. I actually can recall having a few men where when I asked them to do a kegel, the first thing they did is squeeze their butt because they were told to hold in gas when they try to perform a kegel. And this is correct, but if you're holding in gas, is that really going to stop the flow of urine? The answer is no, probably not. Because when you try to do the gas cue, you're activating the back of the pelvic floor. But when you're trying to stop urine, you're activating the front of the pelvic floor. So it's important that we teach them how to properly do a Kegel. And sometimes this means starting from scratch. Because once the prostate is removed, that serves as like a cork when it's present. But when it's removed, men don't have the same control that they initially had. Because some men are actually even pushing when they go to pee versus relaxing when they need to urinate and pee. So the first thing is teaching them how to do a proper Kegel, making sure they're not kind of bearing down or pushing on the pelvic floor, making sure they're not holding their breath, but making sure that they're able to shorten the penis, or sometimes you'll hear the cue, pull your nuts to your gut. So try to pull the sack and lift the sack up using the muscles, not your hands. So that way you can try to get the front of the pelvic floor to activate. The front of the pelvic floor activating is going to help strengthen the muscles that are closest to the urethra. The urethra is pretty much the tube within the body that the urine is expelled from the body. In the penis, the urethra is much longer compared to that of women, where the urethra is much shorter. So now that you've had a mini anatomy lesson, and now that you know that regaining continence is, possible, and how to properly strengthen the pelvic floor, I also want to show you there's a little device that men can use early on that I typically recommend to help minimize the leaking, because there are times where men will have incontinence and not even realize it. They'll just start leaking. And so this little device is called an incontinence clamp. Sometimes you'll also hear it referred to as a penile clamp. And it's a little circular device, well, oval shaped in this case. They come in different designs. This is a design that I tend to lean more so towards because it's easier to apply. Most of my patients are really comfortable using it when we've needed to use a penile clamp and they haven't had any issues. So this is a design I typically recommend. With the penile clamp, it does have these little portions through here. Sometimes you'll see some people refer to it as foam. This is actually not a foam. It's actually more of a silicone-based material. And it's with being on the inside, this portion here, the blue part, is going to add pressure against the urethra. Now, it should be a comfortable pressure, so I'll use my finger to show you. With the clamp, you're not trying to clamp down and cut off everything. You're simply just trying to add pressure. So imagine that you have like a little garden hose, and with the garden hose, you have water going through. But if I add a little bit of pressure on top of that, the leaking of the fluid from the garden hose is going to decrease. The more pressure I add, then it can stop. But in this case, we don't want to add too much pressure because that can be detrimental to the penis. So we want to make sure the penis itself stays healthy and we're not causing pain or irritation there. So before we even place it at the penis, I normally have men just clamp it down on their fingers so that way they can get an idea of the pressure. But with the little clamps, I'll bring it close so you can see the little teeth. Once you just gently snap in, this is going to give a little bit of pressure. Each level is going to give a little bit more pressure, okay? And now I will place it around my finger. That way you can get an idea and see. So with the clamp, good. Just gently pressing down, adding pressure. Good. Adding pressure. So for me, this feels like a good amount of pressure, but just so I can let you know, right here, this feels a little too tight. So in this case here, for me, I don't feel like I have good circulation to the tip of my finger. So this is too tight. If someone's noticing that they're uncomfortable, they're having pain, decreased circulation, I'm going to make sure they loosen the clamp so that way we don't end up with any issues in that area because blood flow is important, okay? Blood flow is very important. So the clamp itself can be easily removed, and it is recommended that when the gentleman does go to urinate, that they take the clamp off so that way they can fully empty and expel from the bladder, and then they can reapply as well. With the clamp, I typically recommend in the beginning that they use it for a short period of time just to make sure they are adjusting well to it. So around 2 hours, if they need to urinate before then, take it off, inspect the skin. So look at the skin, make sure we don't have any skin irritation, any redness, any marks, any bruising, anything of that nature. I have not had anyone experience those symptoms, but it's still something you want to look out for because we are adding compression around pretty body part itself. So we want to make sure that we're looking out for those things. With the clamp, so depending on the manufacturer that you may get a clamp from, some say you can wear it between 8 to 12 hours. It depends. It is an extended period of time, so that's why I have people work up their wear schedule. But also, I make sure they know you cannot sleep in this at night. So with the penile clamp, the incontinence clamp, this can be really helpful to help decrease like the dribbling that can occur throughout the day when you're doing different activities and when you're trying to minimize how many pads you're having to change, or if you're noticing a lot of leakage, it can decrease the amount. So it's something worth a try for men who are noticing that the type of incontinence, but it does not replace the need to try to improve the front portion of the pelvic floor. So trying to improve you being able to do that contraction so you can have better muscle control. So don't forget the cue, pull your nuts to the guts, or even try to shorten your penis. But the key is making sure you're not holding your breath. But I will leave a link for this particular brand of the incontinence ring. This is this particular brand, and also some other brands that you can check out and talk with your medical provider so that way you can figure out, hey, is this a good option for me? Or even going ahead and purchasing it and then bring it into your next visit, because you'll be surprised how many providers still don't know about this, or even how many providers don't know when to prescribe it. So at least that way you can bring it into them and get their advice on as to whether or not they think it'd be good for you, and also, if they haven't heard of it, working with the pelvic floor PT so that way we can guide you as to a proper wear schedule and making sure that you understand how to properly use this device.